Welcome back everybody to MedEd Insights. So we're joined again in this video by Dr. Tariq Azam. If you didn't check it out yet, go over to the other video in this series where we break down kind of his experience with internal medicine and talk a little bit about that specialty. In this video, we're gonna kind of take advantage of his insight as a chief resident here at Mayo's internal medicine program. We're gonna talk through kind of the application process for residency, kind of talk about interview day, and then also just kind of highlight some of the aspects that we think are unique and special about Mayo's program. So if you're interested in internal medicine, looking to apply, or just want some kind of general tips about the whole residency application process, then stick around and watch this video and we'll talk about that whole process. Let's start with the personal statement.
Yeah.
A lot of people, they don't know, what do I write about? How long? How short? Should I, be really, really bold with whatever I talk about or play it really safe? What are your kind of general tips and things that you think are good to think about with personal statements?
The personal statements is by far and away the most stressed part, and it's honestly not very important. They do surveys, the NRMP does surveys of program directors, and you can see how they rank things in terms of importance. Personal statements in the middle to the bottom. So my advice for this, for personal statements, having read now hundreds of them from potential applicants, it's don't be too long. A page, page and a half max.
Sure.
What you want to do is you want to essentially show me why you're going into the field of internal medicine or whichever field you're choosing, and where you want to go, and how you think you're going to get there. So, a lot of times people say, oh, should I start with a quote or should I start with this? It rarely works out well.
Yeah.
And so, things like having an anecdote from, your past or a patient experience without identifying information, obviously. Those do well. Just a short little anecdote that illustrates either what got you interested in something or, what made you decide that whatever field you're going into is the right one for you.
Yeah.
So short, sweet, don't try to do any sort of experimental narrative stuff. This is not the place for that.
I think the only times I've heard about people remembering personal statements is when they were bad.
Yes. And
it's when people tried to just do really outlandish things, like compare themselves to a superhero or like tell these just really, really kind of questionable stories, and it just comes across really poor. So I kind of agree. Kind of play it safe, get the point across why you're interested, share something interesting about yourself if you've got it, but it really isn't that important at the end of the day compared to everything else in your application. Let's talk letters of recommendation.
Sure.
I know I struggled with how to even ask for letters of recommendation because you feel intimidated and you're afraid someone's going to say no. What should students be thinking about when it comes to their letters of rec?
All right. So the first thing you need to do is think about what rotations you're getting those letters on. Okay. So, your first rotation of your third year of medical school may not be a great time to ask for a letter of recommendation.
Sure. Pretty fresh. Don't really know as much. Yeah.
So you may get points dinged just because of your inexperience at that point. At the same time, asking for a letter of recommendation the week before your application's due is probably also not good practice. So my recommendation, generally the second half of your third year, and obviously your sub-Is before you apply in your fourth year are probably the best places to get your clinical letters of recommendation. When you ask somebody to write you a letter, make sure it's somebody who knows you well. I've now reviewed hundreds of letters of recommendation at this point. Most of them are forgettable.
Right.
The best ones are the ones that give me examples. That means that not only did the student do well enough to get a letter of recommendation, but they also impressed the physician enough that they remembered a specific thing. So a much better letter recommendation would be like, for example, student Dr. Tariq did excellent on our hospital medicine rotation. It's a busy inpatient rotation. He took care of 3 to 5 patients per day. In particular, he has an excellent bedside manner with multiple patients and their families commenting on how well he did. In addition, he has excellent interpersonal skills. Nurses truly thought that he was the intern on the team, and his medical knowledge is excellent. He was able to diagnose a case of drug-induced Parkinsonism despite never having seen that before.
So lots of specifics examples.
Yeah.
Nice.
And then usually they close with something like, Dr. Azam is probably in the top 1 or top 5% of medical students that I've had. And, that goes a long way as well.
Nice. All right. So let's talk next about research experiences. And this was one of my big pet peeves because I think there's a lot of just research bloat in terms of people focusing on quantity of research experiences and just trying to hit a number or have the most impressive list. What's important to think about with research experiences on applications?
So full disclosure, I had one case report at a local conference, like within Ohio State, on my CV, and then a couple experiences in undergrad, none of which had publications or anything to show for it. And yet here I am. You're right. People try to kind of play the numbers game, which I don't think is the right thing to do if you're interested in research. And I think most medical students have a passing interest at least. You should try to get involved either during medical school or residency, but have it be something that you're interested in, something that you're passionate about, just so you can complete the project, not burn out while doing it. And then I think most importantly is in your experience section on your application, when you get interviews, speak about it in an intelligent and passionate manner. If I ask somebody, what did you do this, I saw you did this paper on cardiac outcomes, and they're like, I helped out one of the attendings, and I don't know.
They don't really know,
Versus, yes, we were really looking at what happens to patients who don't take aspirin within the first 30 days of an MI. And, I saw this patient in clinic and it was great. That sort of spurred my interest. Those are two completely different stories on the same research project. I know which one of those people I'm going to favor more heavily.
Right.
And so, having a bunch of numbers is, I think, worthless. If you're a big researcher and you do have those numbers, more power to you. Keep doing it.
It's all really good quality.
Yeah, if it's all good quality, you're doing original, fantastic. But I wouldn't do numbers for the sake of numbers.
Sure. Speaking of experiences then, just aside from research, general extracurriculars, volunteer, that whole section people stress about, again, trying to hit kind of numbers.
Yeah.
Talk about that.
Yeah. So, since I didn't have a lot of research experience, I worried about, that as well. But looking back now from where I am now, I think the other sort of things that you do around medical school, those can kind of not make up for research or lack thereof, but I think those sort of things can help boost your application. What I did was I was in student government. I helped run a free clinic. I volunteered for Teach for America and did recruitment stuff for them. And I think just like with research, rather than being a member of 15 interest groups and not really doing a whole lot, focusing on a few that you enjoy, that you're passionate about, and really diving into those. So if you're going to work at a free clinic, don't just volunteer there, but figure out ways to get involved. You could do research there. You could be an administrator there. You could do a lot of different things. Say you're really into like intramural sports. And participate in intramural sports. Organize it. That's a valuable team building experience, right? Sure. And I think that's something that if you can passionately speak about it and write about it, I would look favorably on an application. So there's a lot more that you can do. But again, focus on quality of your experience rather than the quantity.
Yeah. Let's touch briefly on board scores.
Sure.
A lot of people, of course, worry if, you obviously you want to get the best step one score you can. Yeah. Are programs looking at cutoffs? How does the board score get taken in consideration with the rest of the overall application?
So some programs do have cutoffs. We don't have a cutoff for a board score, like a hard cutoff. It's part of the entire application.
Sure.
We do obviously look at it, and it's an important part of your application, but it's not the end-all, be-all. That being said, when I talk to my medical students or first and second years, and they're asking me about step one, I tell them, look, take time, buckle down, take this very seriously.
Probably the most important test you're going to take.
Honestly, once you're in medical school, it is, and for better or for worse, right? I mean, it's never really been shown to track with resident outcomes, but it's there and it's something you have to deal with. So doing the best you can on it is only going to help you. And by not taking it seriously, you're only shooting yourself in the foot. I think that your goal specialty should not be the kind of the measure of how well you should do on step one. You should try to do as good as you can no matter what.
Excellent. Yeah. Nice. Last question kind of in regards to the application process. Sure. I'm sure it's not really possible to put one most important thing, but people always ask, what's the most important thing? What's the first thing you're going to look at on the application? Is it possible to give just kind of one thing, or is there something that stands out more than the others in the application process?
So, everyone will have their own way of doing things. I usually start with the MSPE letter.
Okay. Explain what that is.
And the MSPE letter is the Medical Student Performance Evaluation. It's a standardized letter that your medical school generates that goes out, I think, October 1st, that you have the right to review and ask for changes or edits. And essentially what it is, it's a summary of your evaluations from the day you stepped in to the last day prior to them publishing it. Okay. There's a lot of comments that go in there from your rotations, from your preceptors, from your evaluations. And so just going through that, you get a gauge of how did this student perform overall?
What type of person is this?
What type of person? Like where do they sit in their class? What sort of experiences did they have? So that's where I start.
That's good. Yeah, it's kind of just a general thing. And it's something you can control in the sense of how you do during your rotations affects it.
Absolutely.
But not necessarily something that you have to worry about kind of at the last minute and type up like your personal statement. But it's a great summary. So something to keep in mind when you're going through rotations. You might not think that OBGYN rotation is going to have any impact on your future, but those comments on the evaluations could end up in that letter, which might be one of the first things people look at and certainly is important. Let's move on to interview day. Just every program's different in terms of what they do, the style of the interviews. What just in general should people be kind of prepared for, expecting and remembering on their interview day?
First, be on time. Be early. Be 15 minutes early to pretty much any interview. If you're running late for reasons outside of your control, call the program coordinator and say, hey, I'm really sorry. There's a car accident, my plane's delayed, whatever. And tell them so they can make accommodations to make sure that things, you still get your interview experience. So that's step one, show up early.
Easy.
That one's easy. The next thing is, as much as the program's interviewing you, you're also interviewing the program. So if you have questions, ask them. Obviously, the first question you ask shouldn't be like, okay, well, how often am I going to be on call? That's not a great start because
it's a bad,
I mean, by the fact that you're asking that question first suggests that maybe you don't want to be on call. And so you don't want to give that impression, even if it's not true.
Maybe ask the residents at some other kind of quiet time, those sorts of questions.
Or the pre-interview dinner.
You
should ask those questions, but think about how you're phrasing them and when you're asking them. Research the program beforehand. You'll be surprised at how often that comes in handy because when you're talking to an interviewer and you'll say, oh, well, I noticed that on the curriculum there's 3 months of cardiology. Beyond that, what other experience would I have? So then they know, okay, this guy's done their homework, they're interested in cardiology, and they're asking me a question that I can sell our program by. So that's another thing that you can kind of keep in your interview toolbox, so to speak. There's 2 questions that people really get caught up by. And the first one is probably some variation of, tell me about yourself, tell me why you're here, why this program. So have something to say. So not necessarily script it out, but have something to say. Have a few points that you want to make. Well, I changed my mind about my specialty a lot, but once I did my internal medicine rotation, I realized that taking care of the patient in a longitudinal manner is what mattered to me. And once I did my cardiology rotation, I realized that was a pathophysiology I'm really interested in. And so when I was looking at programs, I saw that the Mayo Clinic is very highly regarded in cardiology. The residents get a lot of exposure to the attendings. And so that's kind of what made me want to come here. That's right there. That's a great intro.
So kind of your elevator pitch.
Exactly.
Yourself, why you're interested. Be prepared.
Be prepared. And then the other question that people really get caught up on, like everyone knows, okay, strength, weakness, hard time. Everyone goes over those. But the one that people get caught up on is, well, what questions do you have?
I don't know. I think they've all been answered.
It's okay to say. It's like, I think in our conversation, most of the things that I needed answered, you'd answered, and I asked the rest. That's okay to say. But be honest, right? It's like, so, where do residents end up after residency? Or, you know, have you had the chance to speak with any alumni of your program, and what do they said about the training?
Sure.
Or my favorite question to ask people, because for some reason nobody ever expects it, is what would you change about your program?
Mm-hmm.
Because that can give you insight into like, okay, where is the program maybe struggling? Because, you know, everyone's trying to put their best foot forward.
Yeah, everyone's got room for improvement.
But and so you'll get a lot of interesting responses to that, and that makes people think. So, you know, always thinking, what questions can I ask them that will give me an answer that's useful for my deciding whether this is a program I like or not.
Nice. So let's move on past kind of the application process.
Yep.
As one of the chiefs at Mayo, sell me on the program. What do you think are some of the unique aspects of the program here, things that make you proud to have trained here and be working here that residents or students might enjoy?
So, you know, obviously Mayo gets a lot of name recognition, and, you know, that has its benefits and its drawbacks. What I like to focus on when I'm discussing with medical students our program, either at interview days or in other settings, is the most important thing for me is a residency where I'm supported to be a trainee and a physician, a residency that is responsive to what the changing needs of the resident environment is, and a culture of collegiality where obviously there's hierarchy because of trainees and attendings, but that barrier is not huge. So those are very important things for me when I was actually looking for residency. And I can tell you that all those things exist at Mayo, and Mayo excels at them. The first thing, you know, a place where that responds to resident needs and wants. So our program really, really does a good job of trying to meet the residents. So, for example, I had maybe 3 big areas of improvement for the program when I was an intern to when I was a senior, and those were: 1, I wanted a better primary care experience; 2, I wanted more procedural experience; and 3, I wanted more ICU experience.
Okay.
That was me when I was an intern second year. Just a couple of years later, what has happened is Dr. Oksentenko, who gets a lot of credit for this because she's the one who makes these things happen, she's our program director, we now have an excellent primary care clinic that's residents. We're all in the same place.
Pretty new, right? Just
brand
this
new.
year, yeah.
And it's going so well. I mean, residents love it. The faculty love it. I get to staff in clinic. It's phenomenal. And I wish I had that. That happened. The concerns about procedures, my second year, they started a procedure service for the first years. So they spent 2 weeks doing paracenteses, LPs, and joints in the hospital, learning ultrasound skills. I got to staff that, and I was so jealous that my interns got to do that. And honestly, they're probably better than I am at a lot of those procedures just because they've had more experience. Third, the ICU experience. You know, we wanted more critical care time. Currently, we do 3 months. Now we've added a 4th month in the second year for our categoricals to do another month of intensive care, focusing a little bit more on more of a sort of independent practice in the setting. There's no longer senior residents, there's just the fellow and the attending, as well as learning more about ventilator management. So there's a whole dedicated week of that. So these changes, all these came from residents vouching for what they think would improve their educational experience. Dr. Oksentenko took the time, fought for this, and got the resources for all of these things. And those are just like 3 of a lot of different things that have been improved. Next, going on to the question of culture, you know, I think one anecdote really sort of encapsulates Mayo Clinic's culture of collegiality. So I was on oncology as an intern, first quarter of the year, inpatient oncology, and there's a question of a patient needing a port line placed. I didn't, and still don't, have any idea on how to choose a port for a patient receiving chemotherapy. I don't know. So I kind of like hemmed and hawed, oh, well, what should I do? Let me Google this. I don't know. Eventually, my consultant, Dr. Coveda, looked at me. He's like, well, what do you want to do? And I was like, I don't know. He's like, why don't you ask someone? I said, who should I ask? He's like, you know what? You should call Dr. So-and-so. They're one of the interventional radiologists. I'm like, oh, I can't do that. I'm an intern. He's like, nonsense. Doot. Hands me the phone. And I'm just like, hi, this is Dr. So-and-so. I'm like, hey, Dr.
Yeah.
So-and-so, my name's Sark, one of the interns. I have this patient. Here's their clinic number. We need a port for chemotherapy. And I was wondering if I could get your opinion. He went through the images with me, and then he's like, you know what? I think a single lumen power port would be best. Is that all right with you?
You're the intern. You're like, yes.
I'm like, sure.
That's
yeah, it's
fine.
great.
Sounds good.
And he's like, if you get the patient NPO at midnight and hold their anticoagulation, I'll get that taken care of tomorrow morning. I said, sure. And sure enough, that got done. That blew my mind, right? That blew my mind.
Yeah.
And that is not the exception. That's the rule here. Like,
Yep.
if you call somebody with a reasonable question, they will be friendly and they will help you out.
Yeah.
And time again, that is the case. If you can say, hey, this is what my patient needs, can you help me out? They will help you out.
Yeah.
And that's been phenomenal.
It's amazing. So I did my prelim year here,
Yep.
and then now I'm in PM&R, and it's beyond just internal medicine. It's like institute wide. I mean, everybody's so nice. Everybody wants to help each other. There really is this atmosphere of collegiality and teamwork that extends across every single specialty, and it makes work so pleasant and enjoyable and gives patients such better outcomes when you don't have fear about contacting the neurosurgeon that took care of someone. You're like, I'm the intern, I have a question. So that's awesome. One of the things I wanted to hit on real quick too, I know obviously this is going to be on social media, and the residency program has a really active Instagram page that we'll kind of link below here. I know that's a big push that's been kind of new this year and something kind of changing in the landscape of medicine. What are your thoughts about social media and being able to use it to, further healthcare and kind of visibility about things?
So a lot of the big push for social media has actually been my baby. I'm the social media chief amongst other things. And so essentially our purpose for it is recruitment. It's kind of saying like, look, this is who we are. This is who we are in the hospital. This is who we are outside the hospital, at conferences. This is our scholarly activity, our clinical activity, to show people that we're someplace that they should consider coming to.
Kind of pulling the curtain back and letting everybody see. Because there's no reason to hide.
Right, there's no reason to hide, and giving them a sample of what you can't see from our official website or from just hearsay. And so that was the purpose for me. I know there's a lot of research been done on social media and education in graduate medical education. Not so much on social media and recruitment. I know that our Twitter account we started this year is quite active. One of the things that we do is we'll repost a lot of tweetorials that are going on about interesting clinical questions. And there's so much out there that no one person would be able to really kind of review all of it, even just in something as narrow as graduate medical education or interventional cardiology or ENT. Like nobody could do all of it. And so being able to participate in that forum has really helped me, not just in terms of my own medical education, but also for recruitment. One of our fellows in Hem-Onc, she's gotten job offers through social media. Not applied somewhere. Somebody just DM'd her on Twitter and said, hey, I've reviewed what you've been talking about in your papers. We think you'd be an excellent fit. Why don't we'll fly you out for an interview next month. And so that's kind of the power of social media moving forward. I think the programs and the physicians who are not engaging are going to be at a disadvantage when it comes to recruitment, whether that's trainees or patients. They're not going to have as many opportunities for academic networking and stuff. So I think it's important to be engaged in. I think you have to be engaged. A bad social media page, so a post every couple of weeks, is probably worse than not having one. And so that's something that we're always trying to avoid. And so I think it's a very interesting space that's probably going to have a lot more impact as time goes on.
I just came across the other day, one of the physiatrists I follow posted something on Twitter that was like an infographic about how to cite social media. And it was something I had never really thought about, but it was like, here's how you should cite a YouTube video. Here's how you should cite a tweet or an Instagram post. Like that seems kind of silly, but there's so much good stuff being shared, and it definitely is the future of just life in general. And so medicine is not immune to that change. And so I think it's awesome that you and the program have really embraced that and seen it as a tool to take advantage of and just help more people. Again, there's it's such a great thing here. I mean, I always tell people that, you know, I never wanted to do internal medicine, but the prelim program here almost kind of changed my mind. And this place is amazing. There's no reason to hide it. There's no reason to not let people see what's going on. And so I love how transparent you guys have been with the program and just being yourselves and being honest and open. So that's great. Well, thank you so much again for taking so much time. I know things are really busy, but this was great. I hope everybody finds it useful, all the students out there watching. Let me know any questions you have down below. I have a pretty easy way to get a hold of this guy. Certainly, I'll kind of link the Instagram and social media pages to the Mayo program so you can follow along and get more information. Again, thank you for watching. Feel free to share this video with anybody else, and we'll talk to you guys next time. Take care.